As a consultant general surgeon with decades of experience in the NHS, I've witnessed firsthand the crucial role we play in the lives of everyday Britons. We are the backbone of the health service, tackling a wide array of conditions that affect people of all ages. From emergency procedures to planned operations, our work is demanding yet deeply rewarding. The NHS relies upon our ability to diagnose, treat and manage a vast spectrum of surgical needs. Our expertise isn't confined to the operating room either. We provide comprehensive care, guiding patients through pre-operative assessments, surgical interventions and post-operative recovery. Our commitment to patient well-being extends beyond the hospital walls, ensuring continuity of care and long-term support. Much of our work involves what we call bread and butter procedures, common conditions that affect a significant portion of the population. Take appendicitis, for example. This painful inflammation of the appendix requires prompt surgical intervention to prevent serious complications, even death. Then there are hernias, a weakness in the abdominal wall that can cause discomfort and lead to bowel obstruction. Gallbladder issues are another common ailment we encounter. Gallstones, for instance, can cause excruciating pain and necessitate surgical removal of the gallbladder. These conditions might sound routine, and indeed we perform these surgeries day in and day out. But let me tell you, for the patient experiencing these issues, it's anything but routine. It's their health, their well-being on the line. One patient I'll never forget was a young lad, barely a teenager, who came in with excruciating abdominal pain. Turned out to be a nasty case of appendicitis. We rushed him into surgery and thankfully we got to it in time. Seeing him a few weeks later back to his mischievous self bouncing around, it brought a smile to my face. Then there was the middle-aged woman, a teacher, who had been living with a painful hernia for years. She was afraid to have surgery, worried about the recovery, the impact on her work, but the pain became unbearable and she finally agreed to the operation. Afterward, she told me it was life-changing. No more pain, no more limitations. She could go back to teaching, back to living her life to the fullest. These are the stories, the transformations that make our work so incredibly rewarding. Section 4, a surgeon's journey, years of dedication. Becoming a general surgeon is no walk in the park. It requires years of rigorous training, dedication, and a genuine passion for patient care. After medical school, aspiring surgeons embark on a demanding training program, honing their surgical skills and acquiring specialist knowledge. The path is challenging, demanding long hours, immense responsibility, and constant learning. But it's also incredibly fulfilling, knowing that you possess the skills and expertise to make a real difference in people's lives. We are constantly evolving, embracing new technologies and surgical techniques to improve patient outcomes. The NHS is fortunate to have some of the best surgeons in the world dedicated to providing the highest standard of care. Section 5. Supporting the invisible guardians of health. General surgery is often overlooked, yet it forms the bedrock of our healthcare system. We are the unseen guardians of public health, working tirelessly to ensure that essential surgical services are available to everyone who needs them. Public awareness and support for general surgery are vital. By understanding the scope of our work and advocating for continued investment in surgical training and resources, we can ensure that the NHS remains a beacon of excellence in healthcare. Our commitment to providing high-quality, accessible surgical care remains unwavering. By working together, we can ensure that everyone has access to the timely and effective surgical interventions they need to live healthier, happier lives.